Hi guys, welcome in. Hello. It is now officially time to do day two. I'm going to hit record. So welcome to day two of the 3-day EKG challenge. We are so excited. It is Sunday. And hello, Carrie, what's up? We have been just super, super thrilled to be with you this week and back tonight. So tonight is fun because out of all the things we do, this is the easiest night. We do arrhythmias, and it's all about just detecting the arrhythmia. There's lots of opportunity to interact. We're going to show you static and dynamic arrhythmias so that you can get some practice. So that's super cool. I noticed Michelle is wearing her heart shirt tonight, rocking it. Hey, Michelle. Oh no. Um, so Jim, Remy is actually not here tonight. He is on a sleepover, but there could be a possibility tomorrow, for him to come on. But if not, you're in our 30-day, you'll get to see him another night. He is actually pretty crazy today, and I needed to lecture, so he had to go sleep over. But anyway, how are you guys doing today? Michelle, how are you doing?
I am doing fabulous. So loving my Sunday, and it is absolutely beautiful in Texas today. So that's lovely, which it's not been.
It's same over here. It's been rainy and now it's sunny and beautiful. So it's almost 4 o'clock. I'm gonna share my slides and get ready. I do want to let you guys know that Michelle is planning something special for you guys tomorrow at the start of our session. She's planning a game, so we're super excited about that. If you've gotten to go to Michelle's games before, you know how much fun they are. But Jim, here's Remy for you if you want a little a little Remy. Here he is. I hope that tides over till you can see him for real. Gave platelets. Okay, so you should definitely relax. So tonight is going to be filled with some basic arrhythmia knowledge, and then we're going to put it to the test. So this is what we like to do in our learning sessions with you. We love to give you the deets, and then we like to see if you retain it. And we like to do it in a non-judgmental environment. Now, yes, watch out for STEMIs, Remy, and we will test you. We will absolutely test you, but in a loving, non-judgmental way. So we're going to use first just some static strips, but I wanted to shout out to a couple people. Actually, there's 10 people who were the top inviters to our group over the past week. And so I posted their names in the Facebook group. A lot of you have already messaged me, but we wanted to make sure that not just the top 5 people, but all top 10 people got prizes because it's no small feat what you guys accomplished this week to get your friends to join with us. And we're super excited that we can help them too. So thank you for that. So day two is arrhythmias. And this is a recap of last night. So somebody actually messaged me privately and said, Jen, I couldn't read your writing here. And I was like, of course you can. That's my awesome writing over there. So in case anybody else was in that boat, this is round. TWA should be round, not notched. And definitely this says ABR and V1. So this was our part of our workbook. If you do need the workbook, let us know, put in the chat. Can definitely get it for you. It looks like Carrie's on, Matt's on, Nuria's on. Hello guys on Zoom. If you want to hop on Zoom, you can, or you can continue watching on Facebook. Either way is fine. A lot of you have also been asking me, hey, it's Sunday, I can't make it. Hey, Callie's logging on. And are you going to do a recording? Yes, we absolutely do record every night. And we put it up in the guide section when we're done, but we also load it onto a replay page so that you can watch it all in one place, which makes it easier. So yes, anyway, that's happening. And we'll post that each day for you guys. Now, as far as getting down to the nitty gritty of what we're going to talk about, hey, what's up, Matt? Matt's on Zoom. We're going to basically give you a strategy here to, when you see an arrhythmia, to solve it. So the 3 questions you're going to want to ask yourself, is it narrow or wide? Okay, narrow or wide. So things that are narrow come from the atrium, things that are wide come from ventricles. And that's kind of a generalization. The only thing that may not follow that rule is if you have a supraventricular tachycardia that takes an aberrant pathway down, right? It can make it wide. But in general, that's the deal. The next thing we want to ask ourselves, is it fast or slow? And if it's too fast or too slow, do we need to intervene right now? And if we do, what do we need to do? Do we need to give them atropine if they're too slow, right? Or if they're too fast, do we need to do a modified Valsalva, right? So what do we need to do? And then is it regular or irregular? So I'm going to grab this EKG here that I'm using just for demo purposes, but I thought it'd be fun. We could take this and I could share with you how this works. So basically from here, let me use something thicker actually. So from here to here, is it the same distance? So that's how you know if something is regular. So last night we talked about the R to R, right? The R to R. And if you do the R to R, that's what you're using. And you can march it out like this, or you can use calipers. Someone on last night said something about calipers, and I'm just kind of curious, how many of you do have calipers? Does anybody actually have my electrophysiologist does have calipers. So, um, what is irregular? Good question. We will be taught. So Jeff, you're back. You were the one who was asking about calipers. So I'm waiting to see if anybody has them. So irregular, we'll show you an example of that. Don't even worry, Jeff. We will bring them back. Yes, not the body fat calipers, Jim. All right, let's talk about the atrial rhythms. So Michelle says she hasn't seen calipers in school. Same. Elias uses calipers. Okay, yeah, this is great. You just have to be careful, right? That you don't stab yourself. That's the big thing. Or that they stab you accidentally while they're in your pocket when you're on a call. So the atrial things, this is the atrium up here, the top of the heart. We know the sinus node lives here. And the things that come from the atrium are atrial flutter, things like AFib or AFib with rapid ventricular response. Does anybody know that about RVR? We were talked about it a little bit last night, but let's see if we can jog your memory. Let's see if we can jog your memory. What is the number you need to have for AFib to be over, what number to be called rapid ventricular response? Yeah, it's actually 100. But Carrie, I'm glad you brought up 120 because Carrie, 120 is actually a very magic number. 120 talks about the width of the QRS, and then actually, you should have less than 120. 120 is also a magic number for the PR interval. It shouldn't be under 120. So 120 is there for a lot of things, but it's the 100 that gets us the it's the RVR category. So SVT is also something, sinus tach, and WPW, and also premature atrial contractions. So I think it was Jeff who was asking about irregularity. So if you go over here, you will use pink. No, let's not use pink. We'll use red. This is a bigger distance away than this is. So this is irregular. Okay. And you need a longer strip to see that it was irregularly irregular, but this is none other than atrial fibrillation. And we know that because of the irregularity of the R to R, but also because of the noise that seems there's noise, there's no discrete P waves on the channel. So if there's no discrete P waves on the channel and you have an asterisk, then essentially that's a big clue you're dealing with an AFib. It looks like a wandering bag of worms. AFib confuses the stink out of me. You're not alone in that. A lot of people are confused by AFib. And I will admit that last night I was working at the hospital and I had a strip that for once threw me. I really thought it was junctional. It had no discrete P wave, but I didn't really see anything on the baseline, but it was irregular. And it turned out to be AFib, and it was overread by cardiology and the other ER doc. And so it was AFib, but it was a very tricky one. It wasn't classic, so I think it is confusing for a lot of folks. What is the difference between atrial fib and atrial flutter? They are different mechanisms, electrically speaking, in the heart. And so, basically, it's hard to explain that without any imaging, but I can show you what it looks like, at least electrically. This is AFib, and I'll show you a flutter in probably a couple slides. So this is what we want to see. We want to see a nice regular R to R, okay? Like this, R to R. It's regular. We want to see a beautiful, discrete P wave, which you do. And you also want to make sure that the P wave is the same shape and morphology. So morphology, if you remember, means shape, size, and what it looks like, basically. And then you also are looking at the PR interval. Okay. So the PR interval is normal. It's under 200. That's right here. And then you want this right here to be under 120. This is computer generated and it almost looks a little bit wide to me, but it's for our purposes, we'll say it's not. And this would be what we call normal. And then this again is another rhythm that comes from the atrium, and it is also irregular. So how many boxes for regular R to R? So it's not a how many boxes thing, it's a measuring distance thing, if they're equal, if that makes sense. So this is something that may trip you up, that you may think is AFib, but it's not. And so essentially, what is happening here, you have to ask yourself the question, is the sinus node still running the heart? Well, how do you know that? You know, last night we talked about the fact that the sinus node makes P. The sinus makes P. Okay? You can see there's lots of P's here, and they are present. So then the next thing you got to ask yourself is the rhythm regular or irregular? So right away, we've ruled out AFib. So it's not AFib. No, you do have P's that are discrete. So it's not. Okay. So the next thing you got to do is you got to measure out the R to R to see if it's regular. This would be a place if you did have calipers, you could use them, but you can also just draw and visually see that this is longer, shorter, right? This is even shorter. So this is an irregular rhythm that has a narrow complex under 120. And the usual reason for this rhythm is breathing. Does anybody want to take a stab at what this is? Oh, good explanation, Michelle. Thank you. That is a great explanation. Yes, Carrie, good job. It is sinus arrhythmia. So this is interesting, actually, because a lot of people say to me, how do you distinguish this from sinus pause? That is a very valid, good question. And I'm going to tell you the answer. You need to have basically for a sinus rhythm, for it to be a sinus pause, you could be lulled into thinking this is a pause. You need a longer strip to basically work it out. So if your R to R is varying a lot like this, when you see a longer strip, it's sinus arrhythmia, which is not bad. It's not a bad rhythm. It doesn't cause anything. It just makes us like worried about pauses or AFib. But if you have a distinct pause and then every other P and QRS are matching up together, then that's more consistent with sinus pause. Okay. So breathing causes this, and we see this in people with good vagal tone, people that are younger, usually people that are athletic, and it's not, again, a bad thing. They don't need anticoagulation, which is exciting. So sinus bradycardia, this is easy. You're going to see that it's slow. You're going to have a rate under 60. And, you have a P wave every single time. There is quite a distance here between the R and R. You can see visually that this is slow and the R to R is regular. So it looks just like a normal sinus, but it's slower. So what kind of things can we do to cause this as providers? What can we do? What kind of things can we put a patient on that can cause this? Medication, absolutely. Beta blocker, yeah, good job. Potentially also calcium channel blockers. And yeah, potentially DIG. That's a good one. And also potentially antiarrhythmics. So good job, Carrie, with the calcium channel blocker and KJ as well. So whenever you're dealing with a Brady, oh, and amiodarone, yes, Elias, exactly, antiarrhythmic drug. Whenever you're dealing with a Brady, you always want to see if it's reversible. And if it is, you fix the problem. So sometimes it's an easy fix. You can decrease their medicine or stop a medicine. But if it hangs around despite all of those things, then and they're symptomatic, sometimes they need pacemakers. So that decision is made by basically getting a Holter monitor on them longer than just one strip. And again, they have to be symptomatic. Otherwise, sometimes the treatment is nothing. That's an interesting thing because we are so programmed to want to do something all the time. And sometimes the best thing to do is nothing. It's hard for us, right? It's hard for all of us as providers. So this is the opposite. This is a rhythm that is fast. It is over 100. It is regular. It has nice discrete Ps. And this is none other than exactly KJ and Matt, a sinus tachycardia. So again, and good job, Carrie. Some common things that we can do to cause this. Can you name any of the things that we could do to cause this? Or not us causing it, but what could a patient have as an underlying thing that's creating this? Good job, Willie Mead. Caffeine, hypovolemia, anxiety, these are all good. Um, Fever is a great one, Tiffany. I like that. That's like sepsis, huge, right? Also thinking about, yep, pain. Another big one I wanted you guys to put on your radar would be a pulmonary embolus. Okay. Pulmonary embolus is also something that you could see tachycardia. It's one of the most common signs. So whenever you have something that's fast, you might be tempted to think it's SVT if it's fast, but you're going to be questioning, is it sinus tach versus SVT? So the way to really get to the bottom of that, yes, stress and excitement, is to ask if they have any reason for like for tach. Are they having any volume loss? Have they been sick? Are they nervous? Are they febrile? Any of those things? Is their thyroid off? But if not, then you lean more towards an SVT, especially if they don't break their stride if you tell them to take a deep breath. Now, this is for, I think it was for, let's see, somebody was asking about atrial flutter earlier. And I'm trying to see who that was. Jeff. Jeff was asking about flutter. Here's flutter. Here's the difference. And so, yes, exactly. You guys got it. So, in a nutshell, the flutter is different on the EKG, the rhythm strip, because you have what are called F waves. Okay. These are called F waves. They're called sawtooth waves. They have two names and they look distinctly different. They are not P waves. And they look like little like picket fences. So this can be regular or irregular. It can be what's called variable conduction would be the irregular one, where maybe there's two and then there's three in a row. But yes, this would be a 3-to-1. Flutter waves look different, as KJ said, exactly. And this one is at risk for stroke, just like AFib. So you need to do a CHADS VASC-2 score and see what their risk is. Absolutely. So this is none other than AFib. We already know that because we know there's irregularly irregular rhythms. But what I wanted to see if you could tell me is basically, could you tell me what a patient would complain of? What a patient would complain of if they have AFib? Um, can you tell me more about what you've heard? What can a patient complain of? Fluttering, I like that. Shortness of breath, good. Palpitations, absolutely. Heart skipping, good. What about fatigue is a good one, Carrie. That was what I was hoping somebody would say. So fatigue or even sometimes confusion, anxious, these are all really good because it can make them feel anxious. So palpitations and dizziness, that's a good one too, Elias. So let's now cover the stuff in the junction. So the junction is in the middle, right? It's the AV node. And the AV node likes to run the heart around 40 to 60 beats per minute. And so there's really just two rhythms in this section to be concerned about, but you won't see the second one, which is accelerated junctional very often, unless you're dealing with post cardiac arrest patients and maybe they've had some epi. So junctional rhythms, how are you going to know something is junctional? You're going to know by the rate and the fact that, as KJ said, there's no P waves. So that's great, KJ. And you can see over here that there would be most likely a P wave here, here, and here, but there's not. There's just flat. And so when you have flat and still narrow, the rate of 40 to 60, that is what it looks like when the AV node runs the heart, and it's called a junctional rhythm. If you didn't have a pulse with this, it would be called pulseless electrical activity, or PEA, right? But this one is pretty simple because very few other things look like it. If the QRS was wider, we might think about um, a if it was wider, we may think about an idioventricular rhythm, which is where we're heading soon, as in now. So let's talk about the ventricular things. So idioventricular, you can see now the difference when they're back to back, right? This is a wider complex. It's definitely over 120, okay, or 0.12, whatever you use. And you can see that there is a regularity to it, idioventricular, and there's no P wave. This patient may or may not have a pulse, okay? May or may not have a pulse. And then this is what happens at the very end of the line when there's basically a dying heart, one little impulse here, and there's no other activity. So this is when the bottom of the heart is trying to run things, not doing a good job because it's not supposed to be. And they may, again, this can also be called pulseless electrical activity. So yeah, the poor guy's trying, but he's just not doing a very good job because he's not designed to run the whole heart. So let's do a couple fast recognition strips. What would we call this? What would we call this? This is a regular, fast, wide. Carrie Foster, yes. Matt, yes. This is a monomorphic VTAC. Good job, Silas. Good job, KJ. You guys are on it. Hey, Shamika, this is VTAC exactly. Hey, Lori. All right, this is great. You guys did good. Okay, let's do some more. So actually, let me just throw a little curveball on you here. If this was on a 12 lead, we would always err on the side that this is VTAC till proven otherwise. But there is a possibility it could be an SVT of the Barensey. So this is a time where we would do a 12 lead. And then if we did a 12 lead, we would basically look for the axis, which is one of the rare times that axis is helpful. The R waves point down in lead 1, 2, and 3, down, down, down. That's more consistent with ventricular. But every wide, fast, regular is V tac until proven otherwise. All right, let's see. Let's test your chops on this one. Silas said, test me. So we have the fastest typer, AFib. Or sorry, VFib, 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 agonal. So agonal is a little more organized in the fact that it doesn't have all this chaos. It's like flat, 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 and then a blip, right? But this is more organized. And so there's no flat line here. This is indeed ventricular fibrillation. Hey, Cheryl, what's up? And also Shamika and Tiffany are all on here, and Willie Mead saying, yes. And Lori, good job. This is a VFib gets the DFib. So is it coarse or fine? So this is coarse. Fine is a little more, I think of it like sandpaper. This is definitely coarse. Fine looks more like asystole, if that's a good explanation right there. This is anarchy in the heart, so we need to defibrillate this. So hopefully the sinus node will take over. We also have ectopic beats, and these are beats that are extra, and they can come in patterns. For example, one every other would be bigeminy. One every three would be trigeminy. And I think of the wheels on a bike to help me kind of remember that. And what are these beats here called? Does anybody want to take a stab? They're either, these are PVCs. Yep. Are they unifocal? Are they unifocal or multifocal? Uni or multi? Good job. Yes. Multifocal. Exactly, KJ and Matt. And Carrie is also saying they are multifocal. Good. So they are PVCs. They're not PACs, right? Because if they're wide, they're coming from the bottom. The narrow ones are the PACs. Okay. So this is your underlying rhythm here with your extra beat. And we know they're multifocal because they are coming from different directions. So they have different morphology. How can you identify a PVC? Well, you have to notice that the morphology is different of this beat. So the definition is premature ventricular contraction. This is early, therefore premature. It is wide, therefore coming from the ventricles, and it's an extra early beat, therefore contraction. and they look wide and aberrant is the terminology, and that's how you spot them. If you are working with monitors or Holters, you see the reports all the time that talk about these. So your machines are set up to identify these. Okay, let's do the workbook part, and then we're going to do a little bit of practice, just so we make sure that if anybody wants to do the workbook, that they have access. Now, this was again from earlier, and then again, just putting this in here for you in case you needed it, although we did put it in the group. And then this was if you were practicing on your rhythms, you have the answers to the workbook. Okay, so the strips that we covered here are AFib, in case you can't read my writing. This was a great chance to practice looking at sinus arrhythmia. And then this was the idioventricular because it's wide and regular and slow. And this is junctional because it's 40 to 60 and no P wave. And so that's what my writing says. I know a lot of people can't read my writing. So let's do a couple really quick practices, and let's just throw at you some craziness. Okay, so we already did this one. I'm going to skip through this one, but what is this one called? Right here. If you saw this pop up, how would you label this? Oh, good job, KJ, fastest typer. KJ says a run of VTAC. Yes, because this is wide, fast, and regular. So it's a run, or also called non-sustained VTAC, right? So that's excellent work. Sinus rhythm with a 6-beat run of VTAC. This is good. Tiffany, yes, run of VTAC. Very good. And you guys all got it. Excellent. Good, good, good. What about this one? This one's easy. Everyone should answer this one. The chat should be flooded right now with the answer, Smarty Pants Matt. Going up to going to juice. I don't know what that means. Silas says, uh-oh. Yes, this is none other than the beautiful asystole. Good job, everybody. Flatline. Good, good, good. Okay. So that one was easy. And this one is, these are the 3-site rhythms. We got to know them. We got to just pump them out. That was asystole, Shamika. I agree. This one is VFib. Okay, good. You guys got these. Let's do some more. What would you call this one if this one came across? What would you call this one? You'd call it a crib? Lori says a crib. I think you meant VFib and you had a typo. Unless that's this new slang I haven't heard. It could be. So this one is right here. You've got fast, 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 fast. Yes. Yes. Good. Tiffany, Willie, SVT, Matt. Yes. So SVT converting to sinus. Exactly. So we could also call this paroxysmal, PSVT, right? You can see this is sinus because you've got beautiful Ps. It's a nice R to R normal rhythm, or sorry, normal rate. Good job, Shamika and Elias. I love that you guys are getting all the answers right. And then this is your supraventricular tachycardia. Good job, everybody. Good job. Now this one is a computer-generated arrhythmia or rhythm strip, which is why it looks kind of funny. But it's a chance to practice looking at P's, looking at your R to R, and looking at your rate. So the question is the sinus node running the heart? And if so, does it appear too fast or too slow? And this does appear a little bit fast. You could use the rule of 300 if you wanted to, the rule of 300 to basically measure, but it is over 100 and therefore it is a sinus tachycardia. Okay, that one was pretty fun. And then this was a good one just to show you that how to find a rhythm strip on a 12 lead. In case any of you don't know this, you probably do, but let's just talk about it just in case, okay? So right here, just to orient yourself, and we're going to do basic 12 leads tomorrow. This is the 12 right here. Okay, this is the 12. And then Carrie, you already got it. Good job, Carrie Foster. This right here is your rhythm strip. Okay, so your rhythm strip. Now the machine will pull out usually V1 for you. Sometimes it will pull in lead 2 down here, but you want to use this strip to determine what rhythm you're in. It's always the one at the bottom. You can see right here, there's a P. Okay, but if you didn't like this and you were like, I'm going to go look somewhere else to see if there's a P, I like lead 2 because a lot of times there is P's. And yeah, so we'll talk about that in a second, Silas. I love that you're thinking about that. The T waves, there is a problem. So Anyway, going back to this, it's a rate of 47, so it's too slow. It does have P's, so it is a sinus Brady. And now we know essentially what rhythm we're dealing with. So Silas said, I don't like the T waves being inverted, which is the perfect language to use. Inverted is upside down, okay? And I would also say, KJ, you're spot on thinking about the fact that these T waves are too big for their QRS, which we talked about yesterday. These T waves and here too. So the two things I would think about with these T waves like this, do they have hyperkalemia or hyperacute T waves? But you guys are actually right. This was not hyperkalemia, and this was a hyperacute T, which means that it's too big for its QRS. That's the definition. And just as a side note, there is actually, in case you've never heard that term before, hyperacute T waves, they are a new STEMI equivalent. Okay, a new STEMI equivalent. So Tiffany's here saying, busting out all the terms. So Tiffany, you must work in cardiology. You are the bee's knees. So I would also say to you, one other thing to think about if the T wave is inverted in lead 3, I would also just bust on over and make sure there wasn't a Q hanging off here. So, and I would make sure there was no deep S wave here because that's what you would see in a pulmonary embolism. But to be honest, a PE would hardly ever be this Brady because PEs usually bring tachycardia with them. So strong work. Tiffany, you're the one we're going to cheat off of later if there's a test, but there's no test. Okay, so that was I'm going to tell you about tonight's prize and I'm going to tell you about last night's prize because, as promised, last night, remember and I'm going to stop my share here so I can show you. Last night we talked about this and the winner of the EKG kit with all the yummy tools in here, the workbooks, the crayons, all the things. This is actually Carrie Ann. So Carrie Ann, hopefully you can message me and get me. I think you already got me your address because you were one of the top inviters. So I can just bust this out to you. So congratulations for last night. But we also have a prize for tonight. So tonight's prize I'm going to show you in a second. And then I wanted to tell you about tomorrow night's prize. So as we mentioned yesterday, if you were here, we talked about the scholarship that we're going to give. Yeah, Shamika, thanks for saying congratulations. Yay. Oh, Tiffany, you took the CME for Life course. Oh, I'm so glad you're here rocking it with us. So you know all the things, Tiffany. You're very smart. But anyway, tonight's prize is actually this thing here. It's the RCAT bundle. It's got a badge that helps you measure the ST elevation. It also helps you measure heart rate on this side. There's also some other things on the back. And this whole thing opens up with all the arrhythmias we talked about. So these are really, really good tools you can keep in your pocket for reference. So we're going to be giving one of these away tonight. So, and if you want to be entered to win on Facebook or Zoom, you can put hashtag EKG. That's fine, easy, hashtag EKG. And I'll be drawing for the prize for this tomorrow. And then for tomorrow's prize, and I still have some more strips for you, so don't go. For tomorrow's prize, we're giving away a scholarship to our 30-day EKG challenge. A lot of the folks on here are in our 30-day. For example, Cheryl, lots of folks are actually in our 30-day. Matt's here, Silas, a lot of these young people are in our, and KJ are in our 30-day. So we're going to be giving away a scholarship to that. So what that is, just so you know, because I already have my eye on a couple of you to win this, it's a 30-day scholarship into 30 days of classes with us that are like this, but deeper level and with more wonderful coaches. For example, Michelle's one of our lead coaches. She does all the basic classes and LVADs. She's amazing. And she makes things really visual and easy to understand. We also have advanced EKG coaches. We have specialty coaches that come in and talk about lipids, sleep apnea, all the things. So lots of stuff going on in that program. It starts again March 11th. And we'll have a couple bonus classes in the middle week between this week and next week where we have arrhythmias testing as well, along with a section called Study Hall where you can submit EKGs and we can go over them. David, our lead EKG instructor. So this is something you really want to win. So let me tell you how you can win that. And you're still are all in the running. I do have somebody who is on my radar already, but if you can beat this person, I won't say if they're male or female, if you can beat them, you could win the scholarship, which would include one of these kits, okay? Mailed to your house and 30 days of access to our classes. So it would get you from basic EKG all the way to at least intermediate by the end of the class. Now, what you're going to do is you're going to be helpful to your fellow students. That's all you have to do. So if your student, you're seeing somebody who's giving the right answer, like cheer them on. If you're seeing somebody that's not giving the right answer, like support them. And, like Kate, I saw KJ do this earlier. KJ won our scholarship like many times actually. But KJ said, hey, that's okay. You didn't guess right, but we're learning. Like be supportive, be nurturing. That's what I'm looking for. That's the person I'm going to choose, the most nurturing person, because that's how we are in our group in the 30-day. We're very open and non-judgmental. And so we look for that in our 3-day. Now, one last thing for you guys tonight to do a little bit of dynamic rhythms is I wanted to share with you a couple rhythms. Now, this is this is actually a workbook that one of our instructors, he's not teaching tonight, but he's come on a lot, Gary Krause, he's an RN of many years who made the prizes I'm showing you. He made these, okay? And basically, yeah, so we've got this Shamika. Oh my gosh. I already like put hearts over your head, Shamika. But basically, he made this and there's some videos. And what I'm going to do is I'm going to show you from his videos. A couple of samples and we're going to use them as practice. So I'm going to pick just a random one. And I want you guys, as soon as you can see the rhythm and know it, I want you guys to type it in. Okay. So here we go. As soon as you see it. Okay. Ooh. Okay. We have lots of chats. Let's see what we got. Paste something. Yes. KJ said dual. Yes. This is paste. It is dual. Awesome job. How do we know that? We know that because, and yes, Jay Nice, exactly. You've got two different markers here, one for the A channel and one for the V channel that tells us it's dual. Okay, so this is paste, Tiffany. Good job. All right, let's do another one. Let's do 37. These are just random. As soon as you know it, type it out. Ooh, this one's juicy. Ooh, I think KJ already got it. Let's see. Let's see. This is a wide complex slow. Lots of you guys are guessing right. Yes, this is idiom ventricular. Good job, you guys. I saw Carrie, I saw Matt, I saw Julie, Lori, Jay Nice. And so what makes this not junctional is just the width of the QRS. If it's wide, it's coming from the bottom. Okay, that's the difference. All right, let's do a couple more just for fun because it's really neat to just see these live and going across your screen. All right. Hmm. No gur, Silas. Okay, so we have some P's. Heart rate of 50. Okay, QRS, the early beat is wide. This is just using the RCAT badge. Okay, so the ST segment's normal, we're measuring. This is some artifact. So you guys got it. All right. Yes, this is awesome. So Sinus Brady with PVCs. Good job, Julie. And good job, everybody who guessed that. Silas, you are spot on. So good job. All right, let's do another one. And these are just like straight practice out of his workbook. The videos come with his workbook. So we're just showing you what these are. Some of his samples. Good job, Jennifer. Welcome in, Jennifer. Yes, Lori. Okay, this one. I hope you guys all see it. I hope it would bite you if it was a snake, right? It's so obvious. Yes, good job, Silas. Good job. Okay, a little bit of ST elevation. So sinus Brady with elevation, but also big T waves. So these are hyperacute. So The two things we would consider, good job, everybody, would be hyperkalemia and ischemia. So excellent, excellent job. Okay. And there is a little bit of liftoff of ST elevation. That's what he's using this red line to measure. And whenever you have the ST elevation, you want to go back in and basically do your 12 lead to see where the elevation is and to see if there's elevation and depression, because then you have to worry about STEMI, KST elevation MI. So as KJ always says, draw your lines. That's what we did here. And yeah, these are great, guys. You guys are doing some good comments on Facebook as well. I'm seeing all of you watching your answers. You're doing great. Let's do 79. Let's see what pops up. Okay. Ooh. Oh, hey, Tanya, what's up? So this is fast, wide, and regular. Silas says VTAC. Matt says VTAC. And KJ says VTAC. Julie, Carrie, everybody, Shamika. So what do we say? Yes. Yes. Good job. Everybody got it right. Strong work. I see you on Facebook. You're rocking it over there. So are these fun? Is this fun to kind of see these? I think I never get tired of these. Okay. Let's do this one. Let's see if this one will pop up for us here. Hmm. Well, this one's delicious. This is delish. This one is, oh, good. You guys got it right. Torsades. Yes. TDP. Look at you guys. You're so smart. Okay, so you can see the twisting of the points. Hey, Kathy, welcome in. You can see they go down and then up and then down. So that's torsades. What usually causes torsades? What usually causes it? So MAG is the treatment, exactly, Julie. And prolonged QT is usually the cause. Good job. Okay, that one was fun. Torsades is definitely a beautiful rhythm. Some people say it's like a twisting of the points. It looks like a ballerina ribbon on the ballerina shoe, whatever those are called. Does anybody know what ballerina shoes are called? But those ribbons. And hypomagnesia. Yes, good. Good job, you guys. Slippers. I'll go with that. All right, good. This is a slow rhythm. Slow. There's also some weirdness going on with the QRS. Okay, so 33, we just measured. And, potentially sinus Brady, potentially. Oh, confused with the bundles. Yes, the bundles can be, you need a 12 lead to see if this is a bundle and what kind. But this is a first degree AV block with bradycardia and ST elevation. And there is some sort of other block. It's going to either be right or left. And you need to have a 12 lead to see which one it is. We do cover blocks a lot in the 30-day EKG challenge if you need more help with that. All right. Also, let's do one more. Let's do 119. And let's see what we got. All right, you guys, come out strong for me here. Let's finish strong of the night with our arrhythmias. Okay. So you can see here that you've got some sort of block. Julie says third. KJ says third. Matt says third. Oh, yeah, you guys got it. You guys all nailed it. Every single person who answered got it right. This is the third degree. There's, as Julie said, there's too many P's, and that's definitely true. So it's a third degree block. So it's not communicating, and that's what's making everything so slow. So this patient needs a pacemaker if it's not reversible, and it's probably not. So strong work. So did you guys have fun with that? Because that was fun for us to watch all your answers. And so seeing that you can do this, you guys know this information. It's just a matter of practice. That's all this is, right? Practice with some support. So Michelle's clapping for you. I don't know if you can see her, but she's clapping for you. So we're gonna be on tonight or tomorrow night with Michelle. She is gonna kick us off, and she's going to do a game, and she's already got it all ready for you. And she's going to help you test your knowledge. And then we're going to do, after that, some basic 12 lead. And in Michelle's game, she is going to cover a systematic approach to reading 12 leads. It's just phenomenal. And you'll get a chance to experience Michelle and what it's like to work with her, which is amazing. And then we'll do basic 12 leads, and then we'll give away the scholarship at the end of the night. And you guys can see who win. So again, remember, the way to be in it to win it is to be supportive, nurturing, and um, just collegial with your fellow students here. Lift each other up, basically, because this world is too full of negativity. We're not going to be part of that. All right. So last thoughts from our wonderful coach, Michelle. Do you have any thoughts?
Just that I put a new game in for tomorrow. So a lot of the stuff that you went through tonight and last night will be in the game. So if you review any of that, you may type in faster. And we're going to pit the Facebook with Zoom tomorrow. So get your fingers typing.
You know who has fast fingers? KJ. So you have to beat KJ's fast fingers. It's really hard to do that. So you have to be ready and poised. So work out your fingers tonight. Anyway, we'll be giving away the prize on the, we'll give you this tomorrow night and then the scholarship. And then, yeah, if you have any questions in the meantime, let us know. Tomorrow is 5 o'clock Pacific Standard. Tomorrow, 5 o'clock. Good question. KJ is asking about mug rugs.
Yes, there's actually two mug rugs back here. So we could put those on for games tomorrow too, Jennifer, if you want.
Yeah, let's do that. See KJ, you're just you're encouraging more giveaways. I love it. All right. So guys, let us know if you have questions and we appreciate you taking your time out on a Sunday. And it just means the world to us that you're here tomorrow night again, 5 o'clock, same Zoom. We'll be putting the recording of this on the replay link, and then we'll also be putting it in the guides. And just so honored to be able to serve all of you. So I know we have a lot of PA moms that just joined today, so we're excited to have you guys here too. So just a little shout out to all y'all. All right, guys, we'll see you tomorrow. Bye.
Bye.